Correct, Mr. President.
Sige po.
Meron din sa BARM.
Yes, meron sa BARM, yes. We have already a cancer fund for this year, 2024, right? 1 billion ata. If I'm not mistaken, tama po.
Same, Mr. President, as
1.25.
2024. 1.25.
1.25. Sige. Just to test if the people have access to this, what's the current balance of the cancer fund as of the moment?
Meron po kasing
Pero ngayon,
going po yung susunod. Going 8 po bakit kaya
I recall, Mr. President, this time last year, the utilization of the 2023 budget was on the low side because the what do you call it? The job order or the joint administrative order was not yet released, but they assured us that there are already patients in line waiting for the services, so they would be able to use the budget that we give them in 2024. So currently, their utilization is still only at 47%, but they have assured us that they will be able to utilize this.
So as of, ano ba date ngayon? 12? Yeah. So as of November 12, 2024, the Cancer Assistance Fund for the year 2024 has been used up to 47%. That's the information that we are getting. Okay. So, okay. At least nagagamit, pero sometimes si PhilHealth, kini-criticize namin na kulang sila ng information dissemination about their programs and benefits. Tayo ba merong, si DOH naman ito, may information dissemination ba tayo na meron tayong Cancer Assistance Fund and how to access the said fund?
Yeah. Yes, they do, Mr. President, and I actually have a report here on what are the causes of bottlenecks or the delay in being able to fully utilize. And information is not one of them. I was discussing on the side already with the secretary that if they can address these bottlenecks, would you like me to read it? The bottlenecks?
Yes, yes.
Yeah. So basically, some sites do not have the complete services. So kunyari, wala kang CT scan doon, hindi mo magagawa. Hindi ma-diagnose na maayos. Baka siguro ma-refer pa yan sa ibang site. That's why I was telling them, give us a complete list of the lacking equipment so that
An access site is a hospital?
Yes. Yes. An access site is where they will go to already get their treatment. Tama, no?
Yes.
And perhaps they would then be referred to their oncologist back at their home. O may prescription na yon. So they can get treatment in the access site or they can get treatment back in their home hospital once they've got the proper diagnosis. It's possible that in their hospital walang complete equipment, no?
So that may not be an access site. If the hospital is not ready to treat cancer, I cannot imagine it being an access site.
Yeah. So the home hospital is not the access site. When they go to the access site, meron nga doon na kulang pa ang gamit. Kaya nga sabi ko, kumpletuhin natin para talagang kompletong access site siya.
Pero
Some have
I think there are thousands of types of cancer, and I have been informed that we are limiting the types of cancer that we are covering with the Cancer Assistance Fund of the DOH. Are we limiting the types of cancer? Or all types of cancer can...
but the reason is
Incidents.
But there-
Marami, you want to help more.
more. So what alam ko yung next question niya. So what do you do with somebody who doesn't so if yung cancer yung
Right.
Okay. So, Mr. President, under the Cancer Assistance Fund, there are 8 focused cancer types: breast, childhood, gynecologic, liver and colorectal, adult, blood, head and neck, lung, prostate, urinary bladder, and kidney. So, for those cancers these are the most prevalent. Because obviously they want to target as many people who have cancer as possible. So for those who may have a particular cancer that is not covered, then the assistance would be by way of MAIP. the hospital. And of course, they can be referred to the hospital that has better
the-
specialists.
What's the logic? Di ba yung cancer, merong protocols, may protocols na yan, di ba? Radiotherapy, chemotherapy. So are we limiting the expenditure to the 8 focus types or open tayo sa other
So-
types of cancer?
So even if the cancer of a particular patient is not included in the 8, but they can be treated by the usual equipment like radiation that is available in the access site, then of course they will be treated. It's not limited because it's not here. It's limited because rare types like, well, now we are treating liver, but my father had to go to another country because wala namang, whether kahit private pa, walang gagawa ng liver transplant dito. So I would assume that those are the limitations.
Yeah, but if it's for a procedure which is an anti-cancer or a therapeutic procedure for cancer, generally speaking, that should be covered by the fund. Whatever the type of the cancer. So I don't understand how come we still need to mention 8 focus types. Hindi ko po makuha. I don't understand it, Mr. President. What's the point?
But not, hindi nakasulat, pero i-copy. Kaya, like what
Them
time?
in the office.
Radiotherapy, chemotherapy.
So the 8 types of cancer, these are the stock that needs to be available for the most prevalent. But if there's a particular kind of cancer that needs a surgeon, any general surgeon can remove that cancerous body part, or remove that cancer
Tumor.
the growth. And then the medication, they will look at what is the best suited for that. If there's a special one, and again, I use my father as an example, when it was a hepatitis virus before it became cancer spread, that medication that was stopping the spread was not available here. It was not yet approved by FDA. So, anong gagawin ng DOH pagka ganon, di ba? So, they'll have to find other means.
So may we know how the fund works? So kunyari, there's someone, let us say, the cancer is covered under the 8 major focus groups. So how does it work? Pabayaran ng DOH through the fund ang gastusin ng pasyente? Ganun po ba yun? As simple as that?
Yes, so these cancer medicines for these the most prevalent cancers are purchased in bulk so that they can get a cheaper price, and then they're distributed to the access sites. So once a patient is seen by their doctor and then referred now to the access site, they can have the further testing and the whole course there, including the medication that would be needed libre. So,
Kaya nga.
kaya may in bulk tayong purchases.
The expectation is there's no ceiling for a patient with cancer. And then,
Complete.
for as long as available ang medisina or chemical, for as long as available ang machine and procedure will be done at no expense to the cancer patient. Is that the simple mechanics of the program or of the fund?
So, Mr. President, with the 1 billion fund, this is projected, projected to cover 36.72% of the forecasted actual needs of patients. Because it's a forecast, you don't know exactly how many people you don't know how many people will present themselves to a doctor. So this projects that 30%, this will cover 30% of the forecasted needs of patients. And that is roughly 8,332 cancer beneficiaries. I recall, and this just is from memory, when we first put in the cancer fund, which I do believe is 2023, which when we put a really big amount for cancer. The reason also for that is we also don't, as a habit, put in a huge number that we don't know if it can be utilized properly. So if this is utilized properly, we are very happy to join our colleagues in moving for a bigger cancer fund. What is that?
Actually siguro more liberal rules and regulations kasi DOH is acting like PhilHealth actually, and the result is like PhilHealth. November na, 53% of the fund hawak pa rin nila. So siguro they now understand why PhilHealth also accumulated lots of reserve funds kasi ganun din ang nangyayari.
The exact reason?
More than ₱500 million pesos nandyan pa sa Cancer Fund, November 12, 2024. Mr. President.
Nagtagal for last year. So, na-upload ang late to October 2020.
What is wrong? Ano bang, what's problem? I'm sure there are more than 8,300
So they had 2.5.
Filipinos sick with cancer. We hope na mas konti, pero I'm sure covered na yung ano na yan. But how come 50 to 53% nandiyan pa rin, Mr. President?
I know, but does that mean you're only using funds after?
It's according to them, there's a COA liquidated budget for liquidation. Ayaw na siya, ayaw
They want
na
liquidation, hindi nila i-defend.
Yeah, so Mr. President, they are bound by COA rules also. So if a specialty hospital, basically the access site, has unliquidated amounts, they will not get the replenishment, and that is quite standard. So I don't know how to, I don't know, and I mean, until it's liquidated, that is a standard I believe that is being followed all over government. So
Kasi actually pinagmamayabang ko rin po ito na meron tayong kasi bago to relatively new yata ito. Yes, I think
that
this
is
is what
correct, Mr. President.
a 3 to 4 year old fund. I think
less pa.
less. Okay,
Less.
pinagmamayabang ko po ito because I still have a memory of the plenary discussion and I think it was led by Your Honor, our chairwoman, right? Did you sponsor the creation of this fund, the cancer fund? I think so.
We did, Mr.
Kasi
President,
I can
yes.
identify it with you eh. So pinagmamayabang ko rin po ito, but then if these are the figures that you're giving us and then you're using COA rules as excuse, parang nagpaasa rin po tayo. Although I'm happy na at least close to ₱500 million na gamit na itulong naman din ninyo pala. So, opo, but then,
Yeah. Well, maybe we can give a firm, make a strong position that the secretary and his whole team is hearing now, that we take it as a disservice to the cancer patients and their families if the next batch of beneficiaries cannot benefit from it because the hospitals are not able to liquidate.
Smaller hospitals na
That's a program. My predecessor, 34 sites. All the hospitals have access to cancer funds.
But not in DOH.
But do they have the diagnostics? Or there are more so if there's more. Oh, according to the secretary, under his leadership, his intention is to increase the access site. So more hospitals would have access so they don't have to go to what was that number? 34, 74, what was it?
34.
The 34 hospitals. Ano ba? Yeah. So that's what they want to do. So are you going to implement that next year?
Yes, basta may oncologist dun sa...
For so long as there's an oncologist, his idea is to give cancer funds to that hospital. So faster access. But you have to tell them to liquidate because at the end of the day, that's also the issue.
hospitals, it's not hard to liquidate. Sa GOCC kasi, networks yung GOCC kasi different entity. Yun yung may bawal na cash advance.
So apparently the DOH hospitals, there's no problem with the liquidation with the DOH hospitals. It's with the specialty hospitals, the GOCCs. So just those.
Sige, can I ask for a listing of the 34 access sites na lang for the
Yes,
cancer fund?
we'll do that.
Any other fund under the responsibility of the DOH na with the same mechanics?
Yung ganon.
Blank, a blank fund for an illness or a disease. May any other fund na ganit may existing sa budget po ninyo? Alam niyo po siguro, Madam Chairwoman, ang purpose ng tanong ko. Gusto kong ipalabas lahat ng anong hawak ng DOH na funds na pwedeng i-access ng taong bayan na so we have this cancer fund, any other fund? Meron pa ba? Announce natin para malaman po ng lahat ng tao. Ito nga, ang liliit kasi nito sinunod din.